Well, thank you for coming. Thanks especially to the diocese and the bishop for hosting us. Thanks to the Mercy College of Health Sciences and obviously to Bo and the Center for Human Flourishing for this invitation. I'm genuinely excited to be with you. My only complaint is that Bo said I really need to talk a really long time because that means it cuts into my time to exchange with you, but I still hope we have lots of time for question and answer and exchange, and including your tough questions. I really want to hear from you, especially if you have a critical question. My thesis, can you hear me okay, by the way? Can you hear me?
Maybe turn it up a little bit.
There is no mic for the room, unfortunately, so I'll just speak up. My thesis is that the pandemic has shown a white-hot spotlight on how throwaway culture has infected elder care, and especially dementia care, and that we are now without excuse when it comes to acting to defend and support this population, which bears the face of Christ in a special way as a classic example of the least among us. Here's my game plan for this evening. First, to talk a bit about what throwaway culture is and how it has infected the way we think about the elderly. Second, to talk a bit about what we learned during the pandemic and why we should be sounding an alarm. Third, to suggest short-term, medium-term, and long-term approaches to resist throwaway culture with a counterculture of responsibility, encounter, and hospitality. And then, like I said, to have good conversation with you. So that's the part I'm here for, by the way. But let's get through this part. I gotta sing for my supper, right? What is throwaway culture? Well, as you may know, Pope Francis uses the term throwaway culture to name a culture which fosters, quote, a mentality in which everything has a price, everything can be bought, everything is negotiable. This way of thinking has room only for a select few, while it discards all those who are unproductive, end quote. It reduces everything, including people, into mere things whose worth consists only in being bought, sold, or used, and then discarded when their market value has been exhausted. We believe, of course, human beings have inherent irreducible value, but when a throwaway culture finds them inconvenient, it deems them inefficient or burdensome or the like, and they are ignored, rejected, and even disposed of. The most serious and obvious example of reducing a person's inherent value to that of a mere thing is, of course, by their being violently discarded and killed. Christians, of course, are especially called to resist this violence because Jesus commanded us to do so. Throughout his life, he took pains, of course, to call out deadly violence. You're familiar with all of that. Pope Francis explicitly resists throwaway culture this way when it employs a violent and often state-sponsored practice like war, genocide, terrorism, the death penalty. But he also argues that the same violent culture includes practices like abortion, and he has some hardcore things to say about abortion. If you didn't know that about Pope Francis, we could talk about that. And euthanasia, where he explicitly invokes the elderly as being treated like baggage to be discarded. Let's talk a little bit more about throwaway culture and the elderly. One of the striking things I find when I talk to recent immigrants about some of the things I've been writing about in recent years, and I meet a lot of them in New Jersey and New York, as you might imagine, and I was told there's a lot of it here in Des Moines as well, which is great, is their utter disbelief about how we treat our elderly. They just can't believe it, right? Really? You just kind of shove them off into a warehouse? Especially when you live in these huge suburban homes and that you largely never see because you're working so much. Essentially, what we're talking about is warehouses of death for a throwaway population, again, baggage to be discarded that is no longer valuable to us. Not least because this population serves as reminders of the fact that we will one day get old and die, if we're lucky. Well, what about throwaway culture and the elderly during the pandemic explicitly? Well, again, my thesis is that it's shown a white-hot spotlight on this problem, and we are now without excuse. You're probably very familiar with the literal throwing away of these populations, right? COVID-positive patients from hospitals into nursing homes, especially in the early part of the pandemic in New York, New Jersey, Michigan, Pennsylvania, and probably many other places. I don't know if this happened here in Iowa, but happen in more than a handful of places around the country, for sure. And of course, the idea that we force so many thousands of people to die alone without the comfort of their loved ones or the sacrament of the sick, one of the worst things that we did, I think. In preparation for writing about this fact for my Purple Catholicism column at Religion News Service, I actually spoke with Ido Banach, President and CEO of the National Hospice and Palliative Care Association. Banach said that data from other countries suggested that receiving home care actually produced better results from a clinical perspective or from a healthcare perspective. In fact, he said a recent study found that the death rate in the hospitals of Italy was twice that of those who were treated at home. Hospitals were breeding grounds for the disease. So even on just a straight up no chaser healthcare analysis, it's probably better to be treated at home than it was in the hospitals. Now, so somebody says, doesn't dying at home raise the risk of infection for hospice professionals as well as family? Well, perhaps, but Banach said that if we make sure that they have the personal protective equipment, some home hospice care providers are at least as safe as those in the ER and ICU. And protections can be implemented for families who consider the admittedly higher risk as worth it. And he even said, suppose the risk level is a small percentage, is raised by a small percentage. That has to be weighed against the very good chance of dropping a loved one off at a hospital and they're dying without being able to say goodbye or receiving the sacrament of the sick. That's a very personal decision that family members ought to be able to make, he said. But we largely and tragically and awfully never allowed many of them to make it. I wanted to focus on the particular example of dementia. In my book, Losing Our Dignity, I highlight two exposés from Politico, one from the Associated Press, which did deep dives into the thousands and thousands and thousands of people with dementia who died not of COVID, but due to neglect. In fact, Robert Anderson, who's chief of mortality statistics at the CDC, of this in the Politico article, was quoted as saying, rather ominously, if I can say so, quote, "There's something going on here and it needs to be sorted out," end quote. Again, a white-hot spotlight was shown on something that was already a problem, but we are now without excuse. We know about it. Interestingly, and I wish I had the opportunity to put this in my book, this came out after I had already turned in the proofs. A New York Times investigation found not only this, but that 1/3 to 1/5 of dementia patients in care homes and other places are actually given antipsychotic drugs, not because they have psychosis, but because they want to put these residents in a chemical straitjacket. It also doubles their chances of death at the same time. If this is where we are now, if we are not willing to put in the necessary resources into the current population's care, and this is why, of course, they're put in a chemical straitjacket, right? That we aren't willing to put the kind of resources into their care that are necessary to treat them like our equals, like human beings. And with the fact that there's no cure even remotely on the horizon, maybe you saw a few months ago the hubbub of Medicare's decision whether or not they were going to cover a particular drug for Alzheimer's disease that showed no basis at all for doing anything for the disease. They approved it despite there being no evidence, just because we're so desperate for something. You put all that together and then add this. The population of those with dementia will double in 20 years. It will triple in 30 years. We are set up for a horror show to turn into a cultural catastrophe. And I am not an alarmist. If you know anything about my work, you know I actually try to dial down people's views that are alarmist. It's time to sound the alarm about this. What options are left to us once the alarm is sounded? Well, I think there are three. First one we might call robot care, or I think maybe a little bit more accurately, algorithm care. I think when we say robots, at least me as a Star Wars nerd, I think of like C-3PO or R2-D2. That's not what we're talking about, right? We're talking about an algorithm. Some see robots as a solution here. While they acknowledge the important role of human caregivers, the folks at Alzheimers.net, which a few seconds after I had been on their website, actually sent me a pop-up asking if I wanted to chat with someone, probably a chatbot, right, about home care. Nevertheless, insisted that robots keep a watchful eye on people with dementia and help combat feelings of isolation, thus taking the pressure off of human beings. A WebMD article was titled, quote, "Robots may soon become Alzheimer's caregivers," end quote, and suggested that such machines can offer, quote, "a number of individualized applications that promote social connectivity," end quote. An artificial intelligence expert recently received a prestigious award bestowed annually to an entrepreneur which improves the lives of the elderly for creating a toy seal intended to be the robot companion of those with advanced dementia. It is worth mentioning also that this is not just abstract. The United Kingdom has moved forward to using robots as not the, but a primary means of addressing the exacerbated loneliness among those in their nursing home population, about half of whom have some kind of dementia. So in some ways, the idea that an algorithm can and should care for patients has already arrived. But unless we are intentional, it will simply become second nature to our healthcare system. So maybe that's one way we could respond, and we could talk about maybe some of the, I hope, fairly obvious limitations of that approach. The second is euthanasia. The Netherlands, for instance, recently found not guilty of murder a doctor who, against the will of her patient, euthanized her. The patient had dementia and had previously requested physician-assisted suicide when she was first diagnosed, but later, after she developed symptoms, changed her mind and said 3 different times that she no longer wanted to die. Her physician and husband dismissed the views of this patient, conspired to have a sedative put into her coffee, and stealthily killed her. After acquitting the doctor, the Netherlands formally moved to legalize sedating patients with dementia before killing them, in part because the new code that was created after this case claims, quote, "It is not necessary for the doctor to agree with the patient on the time and manner in which euthanasia will be given," end quote. Closer to home, you may have seen that Canada recently legalized assisted suicide explicitly on the basis of having a disability. And lest we in the US assume that such things could never happen here, the state of California, which only recently legalized assisted suicide, is already feeling serious pressure to euthanize patients with Alzheimer's disease. There was just a month or two before my book came, I submitted my book manuscript, there was an op-ed in the LA Times arguing for precisely that. In addition, residents and patients with later stage dementia are already killed by omission via starvation and dehydration when someone with power over them determines it's time for them to die. Once the slope of legalized medical killing gets going, it's of course very difficult to stop the slide. And though we aren't quite where the Dutch are and Canada are yet, the fact that we're over-medicating people with dementia with antipsychotic drugs, I think, already is pushing us in the direction of this kind of thing. I mean, what will people really say if that's the option, right? Well, I don't want that, right? I don't want to be given antipsychotic drugs. Give me euthanasia, give me a robot, give me anything but that. Again, that's between the New York Times, between 1/3 and 1/5 of dementia patients already in this situation. Well, a third alternative would be to move to restore human dignity in a way that resists throwaway culture. And for the second half of my presentation, the rest of my presentation this evening, I wanted to think about short, medium, and longer term responses that we can have to do precisely this. And again, if I can say selfishly in the Q&A, I hope we can get even more ideas from you. This is just one person's list, right, or suggestions. I guess it's a little more than half, looking at my pages now, so sorry. Short term, living out a culture of responsibility, encounter, and hospitality right now. A culture of responsibility and encounter is the antidote to throwaway culture, according to Pope Francis. And it's one of the things I think we need to move with now if we're going to sound the cultural alarm, right? And also to not be afraid by offering our theological account of why we do this. My whole book, Losing Our Dignity, is about why it's so important to do that. We can talk more about that if you like. We've just spent decades accommodating, right, those who tell us we have to translate our theology into some other language, and we've seen the results. And we need to work hard explicitly, even as some Christians, good-hearted Christians, fair-minded Christians, nevertheless, nevertheless offer a culturally accommodated Christianity made up of supposedly autonomous, atomized individual persons rather than genuinely connected communities engaging in responsibility, encounter, and hospitality. So what might this look like, practically speaking? Well, here are a few suggestions or examples. Let's put our families first. Realize that just as our parents and other adults in our family circles had an obligation to make great sacrifices for us when we were in that kind of desperate need as children and vulnerable state as children, we have an obligation to make similar kinds of great sacrifices for them. Due to varying levels of economic privilege, not everyone will be able to do this, but if possible, we should make choices about housing, debt, and living situations that allow us to care for our parents and other older family members. So many otherwise privileged people become house poor or debt poor, right? Often, but not only, driven by cultural consumerism, so that we get caught in a two-income trap that handcuffs us to jobs and our places which keep us from attending the needs of our older family members. We should resist the cultural temptation, often but not always driven by cultural consumerism, to live far away from family members who would support us, or live far away from those to whom we have a familial obligation to support in the first place. And I'm very guilty of this myself as somebody that moved out to New York from the Midwest, so I'm not speaking holier than thou here at all. My parents in their mid-70s are all by themselves in northern Indiana, and all three of us have moved away. Resist the cultural temptation, again, often but not always driven by cultural consumerism, to artificially limit the number of children we bear, adopt, or foster. Smaller families, of course, face more challenges in supporting each other than do larger ones, especially given the longer-term recommendations that we'll talk about later. Is worth noting that larger families also tend to produce more religious vocations. Let's talk about that later. Resist the cultural temptation, once again, often but not always driven by cultural consumerism, to think of the home as closed to all but a singular nuclear family. We can work to create spaces for older family members, especially as they lose their capacities, which a secularized and irreligious culture decides makes their life a benefit to them. We should refuse to have family members cared for by robots when other options are available. Once normalized, the Trojan horse of caregiving by algorithm will fundamentally change our relationship to these and other vulnerable populations. I think it's going to be so interesting to see what kind of populations are going to get robots, right? Or what are getting robots, and where we're going to go. I think it's going to say a lot. How about this? Regularly and formally volunteering in nursing homes, especially those that serve patients and residents with dementia, not only to signal publicly the equal human dignity of these populations, but to aid overworked caregivers and staff, who, as you may know, there's a quit on a regular basis because of the backbreaking the work they do for so little pay. How about inviting someone who isn't as plugged into these issues to accompany you if you go? The power of this kind of encounter is formidable. Sorry if this is listy, but I'm going to keep going. Consider careers or intense service projects oriented towards human beings who have lost or are losing traits our dominant culture finds valuable. Many, again, find themselves trapped, again, because of consumerism, in careers and projects they dislike or even hate. Getting out of those careers may free us up to meet the deep challenges that are coming. Work to get government and other resources to empower families to take care of their elderly and disabled loved ones at home. This is an important goal on multiple levels, but it is also quite cost-effective relative to care in nursing homes. Even the worst warehouses of death are way more expensive than care in the home. This was actually part of Biden's Build Back Better plan. There was a real major part of it that was going to reimburse for home, reimbursing for this kind of home aid, and that obviously didn't make it. It was actually one of the first things to go when they trimmed it down. But we also don't have to shove everything, right? We could just pass that part. And finally, work to get government and other resources to provide significantly better care in nursing homes, including better pay and reimbursement rates, especially for specialized dementia care and daycare centers via home and community-based care. I've argued this is a brilliant opportunity for the pro-life movement, in fact, to work with social justice activists in supporting policies that defend the vulnerable and prioritize the extended family. What a great move across political differences that could be, right? All right, end of list. Let's go to medium term. Building bridges of dialogue. Effective dialogue must never paper over real differences. As somebody who works very closely with a lot of different kinds of dialogue, we got to start there, right? We got to start there. And obviously, there are real differences between the so-called Abrahamic religions and the people of the book, Muslims, Christians, Jews. But there are very clear and obvious dialogue partners amongst these three religions as well on this topic. Most traditional Christians, Muslims, and Jews, after all, agree that all human beings have inherent dignity and equal dignity because of a shared nature that reflects the image and likeness of God. In fact, in my book, Losing Our Dignity, I finish with dementia as the issue, but I start with brain death as the thing that kind of got us, in my view, off the rails. And there's only one state in the Union that offers a religious freedom exemption to care for your loved ones with that kind of catastrophic brain injury. It's New Jersey. And it wasn't pro-life Christians that got it. It was Orthodox Jews that fought for it in New Jersey. This is one of several examples. In fact, I reached out to them before the book was published. Like, how did that happen? And how can we work together to do this again? I think we need to do it with dementia. Or we will. Now, those outside of these traditions might disagree, of course, about our theological commitments, but perhaps a genuine dialogue can find overlapping consensus that allows us to support what we're after here in some significant ways. Here it is worth highlighting that more and more so-called Christian atheists or religious agnostics say they do not believe in a God or gods, but nevertheless uphold something akin to a religious moral claim and still often identify as culturally Catholic, Jewish, or Muslim. This phenomenon ranges across political spectrum, from Douglas Murray on the right to Dan Savage on the left, and lots of folks who fall into neither category. Is it so crazy to believe that those with no particular system of faith might reach the same moral conclusions about these matters that Christians, Muslims, and Jews do, even if they cannot accept the way that we get there? I mean, come on, even the lead singer of the Sex Pistols, Johnny Rotten, has become a public advocate for people with dementia. If that can go down, we should have some hope, right? I also want to suggest that there's a series of general values that are largely shared across these differences. Most of those who operate from the secularized and even irreligious perspectives I'm talking about, again, may not follow a general commitment to fundamental equality consistently, but they do have one. Such a commitment often makes them suspicious of consumerism and measuring value based on levels of burden or productivity or ableism. They recognize, at least in a general way, the injustice of ableism, and in other contexts support the disability rights of disabled communities. Many are also generally suspicious. Many are also generally suspicious of claims to individual autonomy, especially when made by those who have power over these vulnerable populations. And those with the commitment to fundamental social justice, including a large number of individuals who are comfortable with secularized values and do not share religious motives, agree that there cannot be a contextual basis for moral, legal, and social value. Justice demands we treat the vulnerable as equals of the powerful at all times, even when this is deeply inconvenient, like when it strains our resources, and perhaps especially when it is deeply inconvenient. The objectively true fact that the vulnerable have fundamental equality with those who are not vulnerable cannot change simply because the social context changes. This is a major thing that we have in common and we can work with. I also think it's significant that in our racial justice moment, our post-George Floyd moment, we are laser focused on the objective value of human beings. A value that those who think differently must accept, whether they like it or not. No room for squishy moral relativism here. Indeed, it is striking to see how the fundamental values that we're talking about here during our racial justice moment is also the fundamental values present in what I'm trying to discuss with you this evening. For example, one of the success stories in police reform relative to its relationship to the black community took place in Camden, New Jersey. Maybe you heard about this. This is not far from where I live. Among other things, Camden dramatically changed how their officers are trained to focus on diffusing encounters and to intervene if they see colleagues mistreating people. According to the New York Times, quote, police officials talk about the, quote, sanctity of life as the overarching thread connecting many of the changes they made. This is confirmed by a report from the police Executive Research Forum, which challenges conventional thinking on police use of force. The first line of the report reads, quote, "Ultimately, this report is about the sanctity of all human life," end quote. With these tools and concepts in common, in a dialogue, we can engage in a fruitful, genuine exchange about whether and how social contexts, again, like scarce health care resources, may be putting at risk the equality of vulnerable populations like our elderly and disabled. Of particular interest will be exchanges about whether and how a sense that someone is a burden or productive seeps into our cultural attitudes about their moral status and value. Shared general values can foster important discussions about how capacities like autonomy, self-awareness, consciousness, or communication reinforce our ableist culture that values particular abilities and undermines the equal moral and legal standing of disabled human beings who may not have them in an actualized state. Now, where could this kind of dialogue take place? Well, I think it could happen in many different contexts, from the halls of Congress to the schools of medicine and nursing, to long-form podcasts, to Thanksgiving dinner tables, yes, perhaps even the discipline of bioethics. What I'm proposing may seem unreasonably hopeful, but I'm under no illusions. This proposed dialogue may not be productive and may not bring about significant changes in our cultural trajectory at this point. How likely is this to happen, even in the medium term, which I'm thinking about here, maybe, 10 years or so? I think there's good reason for hope. And what you have happening here at Mercy College of Health Sciences is Exhibit A. To that, I'd like to add what Dr. Kristen Collier is doing at the University of Michigan Medical School, who I understand was here recently and spoke, to what Dr. Jeff Bishop and Dr. Jason Eberl are doing at St. Louis University's Medical School and Interdisciplinary Bioethics Center, what Farr Curlin is doing at Duke School of Medicine, Carter Sneed at Notre Dame, and a significant number of others. Perhaps these important beginnings suggest that there is enough happening in significant communities of healthcare education around the country to hope that with bold commitment to dialogue and exchange, a counterculture of responsibility, encounter, and hospitality could indeed, to use Bo's phrase, go viral, right? Or your push to go viral. All right, lastly though, long term, what if we fail? What if that fails? What happens if, after about a decade or so, not much has changed, or God forbid, as may happen, things get even worse? If cultural change isn't on the way, I propose that religious organizations and institutions must mobilize for a massive all-hands-on-deck response of our own. And that response needs to start now, if it's going to be ready in 10 years or so, right? Speaking as a Catholic Christian, I can say that while this task is daunting, what I'm about to propose is daunting, not only does the church have the international reach to mobilize for such a response, it would also be consistent with our history of responding to signs of the times like these. How many Christians from the early church responded to plagues and other medical emergencies? And how about the Sisters of Mercy here and so many other places, starting schools all over the world? This is simply who we are as church. Indeed, the elder care and dementia care crisis and coming catastrophe is in some ways precisely the kind of problem that a massive, transnational, multi-millennial religious institution like the Catholic Church has been called to address. Assuming that efforts at dialogue over the next decade do not bear the necessary fruit, religious groups like ours will have to mobilize to house, feed, and otherwise show hospitality to this extraordinary vulnerable population. Again, that's going to double in 20 years and triple in 30 years. Orders like the Sisters of Life and Little Sisters of the Poor, and even greater numbers as the massive needs become clear, no doubt will rise to meet this challenge. But other religious orders will certainly need to retool their mission to address it as well. Brand new orders will likely need to be created, as has happened in centuries past, and actually with the Sisters of Life themselves, right? They were created as a brand new order to address the issue of prenatal justice and justice for women in difficult situations. And they are turning away vocations at this point, right? They're just incredibly successful. And of course, we'll simply need more vocations to the religious life, including lay religious life, and as I mentioned earlier, that tends to come from larger families, so maybe something to see how all this is connected. Hundreds and hundreds of new hospitals and clinics, along with thousands of nursing homes, will need to be built and maintained. And if the surrounding culture is hostile to our understanding of fundamental human equality, we must be prepared, again, as we have been in the past, to build institutions that resist these practices. And I tell my students usually the first person to invoke Nazi Germany loses the game, but here I'm going to invoke Nazi Germany. I think in a good way or appropriate way. You can see in question and answer if you think so. And here I have in mind what I hope does not turn out to be an eerily similar comparison to how a significant number of German Catholics resisted the Nazi euthanasia program aimed at lives unworthy of life. Indeed, given what we have explored together this evening, it is worth pausing on the fact that nearly 50% of physicians, much higher than any other profession, joined the Nazi Party, and they were 7 times more likely than other employed German males to join the SS. Ashley K. Fernandez points out with deep concern in our current culture and moment in medicine, or points this out. He points those statistics out with a deep concern for our current moment in medicine, one in which he sees a new and ominous focus on the state and public health and quality of life over the good and radical equality of all human beings. Nazi physicians, disturbingly, were eager to move from the doctor of the individual to the doctor of the nation. Fernandez has reason to worry that we are moving in this direction again. Like the German resistance of that day, our Catholic hospitals and other healthcare institutions must be ready to resist. Perhaps we can look to the example of Bishop Clemens van Galen, who inspired such public backlash that the Nazis ended up abandoning their program of euthanasia for disabled adults for a time. According to the historian Richard J. Evans, nurses and orderlies, especially in Catholic institutions for the sick and disabled, were able, quote, seriously to obstruct the process of registration, end quote, in these circumstances. Sister Annabeth Koenigsegg, a member of the Congregation of the Sisters of Mercy of St. Vincent de Paul, was one of the most important leaders of the resistance against forced sterilizations and euthanasia of the disabled. She was arrested by the Gestapo, and later the whole congregation had their property confiscated throughout the Reich. But their general resistance was embodied and effective. And our own Christian health institutions must be prepared to resist in similar ways, I believe. Never registering the elderly or disabled for euthanasia, religious orders refusing to cooperate even if the government confiscates their property, local bishops along with other church leaders inspiring the people to rise up in defense of the radically equal value of every human life. Our institutions must also pay professional staff who care for this population, including home care staff, a living wage, a commitment that will require substantial resources on our part, obviously. Perhaps, I'm thinking about how this might happen, I thought maybe this is an area for dialogue too. Can Catholics and Protestants kind of put our differences aside and pool our resources in ways where we can work together to meet this kind of challenge? Such support must come not only from the hierarchical leadership, of course, but from the bottom up, with local parishes and churches setting up programs by which parishioners will go to work in local facilities and visit with residents, take them on walks, help at meals, treat them with the fundamental equality they deserve. We will also need to cooperate with our fellow people of the book, Muslims and Jews, and with all those committed to be a countercultural light in the darkness of a society that disregards and even undermines fundamental human equality in this way. Well, that's big. If you're thinking that such a gargantuan undertaking might require a new religious revival, especially in a secularized consumerist context of the West, I suspect you're right. And perhaps it sounds like wish casting on my part, but I do wonder if our looming catastrophe might actually motivate such a revival. Great people in the church's past, after all, began their lives caught in the trap of consumerism, but escaped to serve the most vulnerable during healthcare emergencies. During the first stages of the COVID-19 pandemic, president of Fordham University, where I teach, Father Joseph McShane, S.J., sent our entire university community weekly pastoral messages. Sometimes I wonder why we didn't get them any other time, but we got them during the pandemic at least. And here's a beautiful one. On Sunday, May 29th, 2020, for instance, he sent us a note about how he had wept before a stained glass window at the University Church depicting the image of St. Aloysius Gonzaga receiving his first communion from St. Charles Borromeo, the Archbishop of Milan. The story he related of St. Al is worth quoting at some length. To say that he was a child of privilege would be an understatement, a vast understatement. A budding princeling, Aloysius spent his early life among the courtiers of the noble houses of Renaissance Italy, those hotbeds of ambition, corruption, intrigue, and power, with a few side trips to the Habsburg courts of Spain and Austria. Although he was destined to inherit his father's title and a life of privilege, his head was not turned by what he saw in those settings, far from it. In fact, he was deeply troubled by the venality and corruption he encountered in them and decided at an early age to enter the newly founded Society of Jesus. His father was furious. Aloysius stood his ground. He renounced his titles and his inheritance and left behind the life his father wanted for him. After he entered the Jesuits, he pursued his studies at the Roman College where St. Robert Bellarmine was his spiritual director. This is just like a murderer's row of people, right? My gosh. When a plague broke out in Rome, like many of his young Jesuit confreres, he worked in the city's hospitals, ministering to its victims. When his superiors, for fear of incurring his father's wrath, forbade him to continue his work, he pleaded with them to allow him to continue. They relented, but with a catch. They told him that he could only work in a hospital that did not serve contagious patients. He accepted the assignment on the spot. In the course of his service, however, he cared for a patient who in fact had been infected with the plague and was himself infected. He died shortly thereafter. His brethren recognized his holiness, they recognized his heroism, they recognized his goodness. They were also astounded by the magnitude of the sacrifices he had made, giving up the life of a courtier to live a life of simplicity, and giving up his life to serve the suffering. His old spiritual director, Robert Bellarmine, a saint and scholar and cardinal, was so impressed by Aloysius that he asked to be buried at his feet. Throughout his life, and in the manner of his death then, Aloysius was a sign of contradiction, or a living oxymoron. He was a humble noble. End quote. Millions and millions of people in the consumerist West, I would argue, are like the early Aloysius, spiritually adrift, vocationally frustrated, addicted to the empty practices of buying and selling, mortally lonely, and looking for meaning in their lives. Is it outrageous to think that dozens of millions of lukewarm or falling away Christians of various stripes will be deeply troubled by the venality and corruption in their daily lives and amid a cultural emergency come to grips with the importance of religious faith for the broader culture in which they live? Wouldn't the millions of human beings with late-stage dementia at risk of being discarded as mere things also tug at the spiritual heartstrings of traditional believers who are not really active in living out their faith in this kind of social justice context? And wouldn't the massive mobilization efforts themselves, perhaps like the efforts of the early church, which caused so many early Christians to convert, be similarly attractive to new converts today? Some, no doubt, would decide to enter newly refounded religious orders like St. Al. What energy, what hope such a movement could bring? How much could it build? How many could it serve? It would truly be a light, the light of Christ shining in a terrible darkness. But we haven't reached that final stage of terrible darkness. Over the coming decade, the medium-term goal of dialogue across differences on these issues can and should be pursued with high energy. If we can rekindle a broad cultural fire in defense of fundamental human equality, that would obviously be the better option, right? And don't forget the short-term goals, many of which we can work toward immediately as individuals, families, churches, communities. And here, ending on a note of immediate action, I want to give sacred scripture the last word. This is from Sirach 3:12-15. My son, be steadfast in honoring your father. Do not grieve him as long as he lives. Even if his mind fails, be considerate of him. Do not revile him because you are in your prime. Kindness to a father will not be forgotten. It will serve as a sin offering. It will take lasting root. In a time of trouble, it will be recalled to your advantage. Like warmth upon frost, it will melt away your sins. Thank you. So I don't know what time we have available for questions or how you'd like to do it.
Plenty of time. God's granted us all the time we need.
Okay.
Yes, 15 minutes at least. I only ask when someone asks you a question, you repeat it for people on the line.
Okay.
So in that, let's translate that. Make your questions short, people. And I'll see if there's anybody who has questions out here.
Okay.
So go for it, folks.
I have a question. Have you, in your research, looked at the spiritual needs of a person with dementia? I've been reading some articles about, the physical, the mind declines, that there's the spiritual growth in that individual. And I think when you talked about the tug of your heart, to see that in an individual that you love, it really does tug at your heart.
Right.
So I was wondering if you've done that.
No, but I should have. And I can't, as you were talking, I couldn't help but thinking about my appeal. Oh, that's right. Thank you, Bishop. Thank you. So the question is, what about the spiritual needs of our elders and those with dementia? It's an opportunity for growth. It's an opportunity for coming closer to Christ. And how can part of our response honor that, as well as what I was talking about? It seems to me that's a really important point to be made, especially in light of the need for religious orders coming up and stepping up to the plate here and serving in a particular way. But obviously not only religious orders, but there's a kind of mutual growth that can take place from the kind of responsibility, encounter, and hospitality that is the countercultural to throwaway culture, which would affect both groups, right? And could in theory meet the spiritual needs of both groups. And so I take your point that that's a really important thing to focus on as well. Yes.
So I have multiple questions all around caregivers, but I'll parse them one at a time for you. The first is, have you researched anything with current opportunities for caregiver education? Because caregivers are usually the first line in making decisions for their loved ones.
To a certain extent, yes. Repeat the question. Caregivers are on the front line when it comes to caring for their loved ones. Have I researched? It's interesting. The first two questions are asking about what I've researched. So, have I researched the kind of training that we're giving caregivers? Is that the first question?
Training, support.
Training, support, education. Yeah, my very strong sense from the research I've done is that the answer is no. Either at home or in a kind of warehouse setting, a care home setting. And in particular, well, obviously at home, it's virtually non-existent. But even you might imagine the professionals in a care home setting are highly trained and well-trained. That's just not the case at all. I mean, you can really kind of go just completely online now for just a few weeks and get your nurse's aid certificate and just be hired, especially because they're so desperate for people. And that's a big problem because the lack of training, the lack of professionalism, the lack of education can result in things you might imagine. One of the things that happened most horrifically during the pandemic that I saw in this context was a resident with dementia got outside of the home and froze to death outside. Now that probably comes from both bad training and education and also just being wildly understaffed too, which are probably related things. But you said you had more questions, so I'll try to remember to repeat them.
having been in that situation, I relied on physicians who provide advice, and I discovered it was bad advice. It was, to me, the bad choice. And so I would love to see programming for people, even before you get into the role of caregiving, as human beings, as Catholics, as Christians, as human beings, to become aware of situations, because in the moment when emergency strikes and the doctor says sign here, people do it because they trust the doctor, and we have to learn not to trust the doctor.
So I don't know that there was a question there, but your comment was one of my favorite lines of when John Carr of Georgetown Fields, he says, make sure your question is in the form of a question. But no, I'm very sympathetic to what you said, and I'll try to re-say it. Without this kind of education and training, individuals can be really susceptible, and especially in desperate situations, to what a physician or another member of the healthcare team might say. And often it's, or at least a significant amount of the time, it's not good advice, and in fact the wrong thing, which doesn't surprise me at all, frankly. Again, my book, Losing Our Dignity, is really trying to suggest that the secularized and even irreligious healthcare system that's developed over the last 40, 50 years is moving in the very direction that is producing this catastrophe. So, and it often comes from a kind of ableist, utilitarian perspective that is so prevalent in contemporary medicine, which translates into, I don't know if that's what happened in your particular situation, but often translates into making a judgment about an individual's quality of life, which leads to some of the things that we've discussed. So that's another thing the church and our allies in moving to address this needs to be very clear about, very clearly.
I'll let somebody else ask the question.
You mentioned about situations where consumerism kind of creates conditions where when there is a need, to care for a parent or something like that, that a person feels really incapable, maybe because of the, decisions that they made leading up to that point. And that makes a lot of sense to me, and I'm wondering if you have thoughts about, what's our off-ramp for the consumerism so that we feel free to care for the needs that are before us.
Well, I'm not a politician or an economist, but in trying to think about this, your question is the often consumerist decisions we make before these even become issues can often put us in very disadvantageous positions when it comes to making choices to care for our elderly and demented loved ones. So how can we push back against that? How can we resist that? Is there an off-ramp for that? I think it's so interesting that one of the popular candidates from the Democratic Party for president last time around was Elizabeth Warren, who wrote a book called The Two-Income Trap that almost everyone I talk to thinks is a good book who's read it, across party lines, right? Democrat, Republican. There seems to be some sense that if two people want to work, that's fine. But if you're trapped in that two-income place, such that you can't make financial moves or take care of your loved ones or whatever it would mean to do a number of things, but including this, there's something deeply wrong. So, again, I'm not an economist. I'm not a policy person. I'm not a politician. But there seems to be something that we could do across party lines, and maybe the Catholic Church could be. Something like Catholic Charities or something, or other arms of the church could really be a leader in trying to find coalitions to do something like this. How can we resist the two-income trap? How can we resist the kind of house poorness that is coming from these really artificially inflated housing prices and whatnot? How can we give tax breaks? Bo and I were talking about this on his podcast earlier today. How can we give tax breaks to people, not only to take care of their children and to have children, but also take care of their elderly, right, and their parents? I argued on the podcast that we should give exactly the same kind of tax breaks to families who choose to take care of their loved ones. And obviously, taking care of your loved ones at home should be reimbursed. There should be reimbursed care as well, especially because it's cheaper than the kind of care Medicare and Medicaid are going to pay in even the worst, warehouses. So I don't know if that answers your question, but maybe that points in the direction of some places we might be able to go.
Thank you. And if I could, because I think about the two-income trap sometimes. I haven't read the book, but do you have a sense, is that maybe more rooted in like unlivable wages, or more rooted in our desire to live extravagantly?
I think it's a combination of living extravagantly, but then the living extravagantly driving up prices in such a way that two incomes are presumed, structurally speaking, for the housing prices. And so maybe that's one of the perniciousness of structural sin and social sin, right? Is it doesn't. There is the particular examples of kind of a gross extravagance, but then that kind of drives up the prices in ways that that are difficult for all of us.
And on that note, on one hand, there's a way in which the elderly have embodied some of the very cultural forces that have put them in the situations confronting. And so one of the difficulties that we might get right is we have to resist our own parents saying things like, I don't want to be a burden. So what is a good way to have that conversation with someone? The person we're resisting is actually the person that we're trying to help. And remember to repeat the question.
Especially really good ones like that. The question is, sometimes, maybe a lot of the time, the problem comes from the very folks we want to help, that we want to reach out to, because, again, sometimes because of consumerism, not always, but often maybe this desire to kind of tell you, both yourself and to your children, to kind of not think about family, go out and fly free and pursue your dreams. And that's what my parents told me, right? That's why all three of us left, and my parents are now alone in northern Indiana. I was talking to Bo again on our podcast earlier how one of my favorite bioethics articles of all time was in First Things a few years back by Gilbert Mylander, called "I Want to Burden My Loved Ones," in which he it's really funny, good article, you should read it. But he compares the kind of burdens that our children put on us with the kind of burdens that our older family members put on us, and say we have very similar kinds of responsibilities, unchosen responsibilities, in both cases. And actually, in both cases, to your point, there can be this kind of mutual benefit, and often mutual spiritual benefit, that goes on as a result of that. And so maybe we need to do a little bit less of, is it fair to say, telling our children, go out and do whatever you want, and don't worry about us, we'll be fine. And in a related story, maybe we should try to live closer to our extended families and think about ways we can support each other across generations and in these ways. And here's a final thing I'll say. I wonder if this shouldn't be something that marriage prep should directly address, so that when a couple is coming together with their pastor and they're asking questions about their futures, these questions should be asked explicitly. Like, what about our parents? Like, how does that fit into our life project together? So that it isn't something that you're just happening most of the time, like happening for my siblings now, like, holy crap, our parents are in their mid-70s and none of us are there to help them. And none of us are really in a position, because of maybe some of the things that question suggested, where it would take a major thing for any of the three of us to come. So maybe if, my wife and I, or my parents even, had talked about these things many years ago, we wouldn't be in this situation right now.
Can I piggyback on that? So practically speaking, then, what does it look like to take care of somebody with dementia from home? I've known some family members, or not family members, but friends who've wanted to take care of their loved ones from home and just have found that it's impossible. They feel it's impossible to be able to do it properly from home, even if one of the people stays home and is not a couple with 2 full-time jobs.
Right. So especially at the question is, what does it look like to care for someone with dementia at home, especially given that the level of burden is really substantial, and even in many cases too much for even one full-time person at home to address, which is very important. I don't want anything I'm saying to kind of paper over what exactly the burden is here and what a difficult thing it can be. What I will say, though, is that, again, I'll just mention this another time, the people who are paid to take care and do this kind of really significant work in care homes are paid pennies and are not well trained, and there's huge turnover. And it's rampant. I didn't even get to the levels of abuse that happens, and financial and other kinds of abuse. So it wouldn't, the thing that I am envisioning here, and I'm not the only one, of course, this is a big part of what Build Back Better would have done, or at least part of it would have done, is it envisions professional staff coming to the home as well and working within the home as well, so that it's not just me trying to change my dad's undergarments or something, but I can have the help of a professional in doing that. And from the data I've seen, and admittedly it's coming from people who are advocates for this thing, so I can't independently verify the data, but the data I've seen from these groups is that you might say, well, that's pretty expensive. It's not as expensive as what it costs to take care of them in a long-term care facility. And then let me say this as a final point. At least in my experience, the early stages are not the kind of backbreaking work that the final stages are too. So we could even have a focus maybe on, let's not be so quick to warehouse again our elderly in those early stages, and then maybe at the end of the day, especially if we don't have the kind of in-home care that's necessary, we will have to use professional facilities. But then let's make certain that these professional facilities are in fact treating these individuals the way they ought to be treated. Should we wait to hear from one other person before we go back? Yeah, if there are any other questions from others.
So there's probably not a good answer to this one, but what sort of counsel would you have for people who work in existing systems who are themselves frustrated by all the stuff you just said?
What counsel would you have for those working in existing systems who are themselves frustrated by everything I just said? Well, I would say that I would love to hear a talk from you on this, because I'm obviously not there. But I would reiterate a few things, or a couple things. One is, please make as much noise as you can about this, like be the greasy wheel that gets the grease, or the squeaky wheel that gets the grease. I don't know that the squeaky, yeah, be a squeaky wheel or something. And really talk to as many people you can about just what's happening. The thing I found most interesting, and or at least very interesting about having written this book and giving a number of talks on this now, is how few people actually know about this, right? Even after the pandemic. You might think after the pandemic, or we're in the midst of the pandemic. I get called all the time for saying the pandemic's over. I don't know where we passed some sort of point in the pandemic where this was really highlighted and all over the news. We are now without excuse, but I still find a lot of people who haven't absorbed it or never really thought that hard about it, I guess. So the more people you can share with how bad things are and how bad they're likely to get, and maybe even in an opportunity sense. Again, Bo and I were talking about this on the podcast too. We have an institution that we work for, or many of us do, that has a range of institutions working in these spaces, but also parishes and other communities have young people who need to get confirmation service hours and who are desperately lonely and need real embodied interactions. Is it just so ridiculous? Is it ridiculous to think about? Maybe it is, but to think about a kind of intergenerational approach within the church in which young people who are desperately in need of relationships, embodied relationships, and older people who are desperately in need of the same can have a mutually beneficial intergenerational relationship. And could the church facilitate that, right? Could you make a case in your own environment, I guess, this would really help us out if we could have this, you know? I don't know what your experience is like of confirmation hours, but the next time we just have somebody putting pizza on a pizza slice on a plate like 17 times, and that's their confirmation hours for the week. You know, there's many better ways we could put kids in better situations, seems to me, and maybe this is one of them.
I believe that's possible. I was fortunate to be chaplain at a care facility, one of the largest care facilities in Iowa, Northeast Iowa, formerly Franciscan, and it's kept some of that charism. It's part of the cultural ethos, but there was a large intergenerational piece of that where the community just kind of knew that this was a place. Yeah, to get service hours on a practical level, but it was something beautiful, and I tried to facilitate that on one level too with college students, but it gives you hope, but it awakens some and had some vocational flowering, on a small scale, but so what you say strikes a chord.
So Bishop mentioned that he's seen this work in other contexts as well, intergenerational, even producing vocations, which I'll just take the chance to piggyback on. I was at Mount Mercy College on Monday giving a different version of a talk on my book, and there were a couple of young women discerning vocations to the religious life who came to the talk, and we had conversation. And one of the things they mentioned is just, in fact, being around Sisters of Mercy. They were actually doing kind of a pen pal thing with the sisters because they're kind of almost cloistered at this point during the pandemic, as you might imagine, given their age. But they still had these relationships, which were beautiful. And they said, a major part of the problem is just not being around women religious. That's just, so if you can imagine the kind of synergy that could happen here, if there were in fact women religious, Franciscans or others, just religious folks in general, avowed religious folks in general, working alongside young people, you can imagine the synergy that could create.
Do you know of a compendium of best practices so that we don't have to all start from square one, but we can explore what has been successful in other dioceses, other institutions, to help us make programs?
Do you know of anyone or any book or text that has kind of made a list or a compendium of best practices so we don't have to reinvent the wheel every single time for this across dioceses and parishes? Is it dioceses or is it diocese? Could somebody settle this for me? It's what?
Diassume.
I think the answer is no. I don't think there is one, but I'd be happy to be corrected on that. But I don't know if you heard about this new Center for Human Flourishing, run by Bo Bonner here at the Mercy College of Health Sciences. They're very interested in putting publications up on their website for general use. I wonder if something like this could be of interest. We would need to have it be broadly done by people working on the ground, obviously. But certainly that resource, especially if we're going to start sometime soon with a kind of 10-year plan or something like that, I don't know exactly what it would be, to be ready if the medium-term dialogue fails and it's got to be the church to step up here. We should be ready, we should be ready.
I'm hoping my question is in the form of a question. But with your section on dialogue, I think one thing that was encouraging to me over the last few years is seeing some of this in public. So I think of the movie Coco, which is widely popular and is about the nuclear family being sort of like imposed upon by older members, etc., and even praying for the dead in that film. And that's what elicits my question. Have you done work or thought about how our relation to the dead maybe influences the way that we think about caring for those with terminal illness, etc.?
The question is, it was in the form of a question, there are movies and other media out there who are somewhat, which are few and some few far between somewhat, but who do invoke challenges, these kind of challenges, the nuclear family and thinking about disability and death and whatnot and elder care. Anthony Hopkins just did a new movie too on someone with dementia, right? Does anybody remember the title of that movie? I've been meaning to see it, but I haven't seen it yet. It's got good reviews. And so remind me, I got the first part, but I forgot the second part. The actual question was?
Yeah, when Bo and I taught bioethics together, we would talk some about practices specifically related to our relationship with those who have already passed on.
That's right.
The dead and how. Yeah.
Right. So the question was, how might practices with regard to the dead impact some of what we're talking about here? And it sounds like maybe you and Bo have thought about this more than I have, so I'd be eager to hear what you think. But my initial reaction is to say a big part of why we don't take our elderly loved ones into the home who are on their way to death, I think, is because of the kind of particular cultural aversion we have to being reminded of our own death. And of death in general, right? That's part of what throwaway culture is. We just kind of push it to the side. We just don't want to think about it. We kind of don't have to engage it. But the practices that I think you have in mind, and this Lent, I've been trying to be intentional about praying for the dead. I have a list I try to go through every morning. It seems to me those would be the kinds of practices that might push back against that culture, right? That tries to push death away and not face it. But if you're praying for the dead every day and you're thinking about the dead every day, you're thinking about that death is not the end, but Christ has defeated death and these folks are still here for us to invoke and to pray for, that maybe that could be an important part of resisting the kind of impulse that would lead people to kind of warehouse their elders rather than welcome in their home. I don't know if that's what you have in mind or not, but...